Thank you, Speaker. Would you tell me, please, which way I ought to go from here? That depends a good deal on where you want to get to, said the Cheshire Cat. In healthcare, and especially in a cross-border, rapidly growing region like Albury-Wodonga, strategic direction is vital. We know where we want to go. We want a trusted, sustainable, digitally enabled, patient-centred health service, a system where care is equitable, not divided by a river, postcode or state border. A service that delivers care close to home, supports its workforce and is driven by data, not disconnected paper. The $558 million investment in the redevelopment of the Albury campus of Albury-Wodonga Health is pivotal. Importantly, on the day of the announcement in 2022, the Victorian Premier labelled it Stage 1, a recognition that regional healthcare cannot be a one-off investment. We require planning and funding for future stages. This future must include the development of a unified site for Albury-Wodonga Health. As CEO Michael Kalimnios said in 2021, in the next 20 years we need to have the issues solved and be working from a single site. Buildings create the space. It is the people, systems, technology and funding models, though, that fill that space with life-saving outcomes. It is all these pillars we must address to build a stronger future for our region's healthcare. No vision for the future is complete without our people. The best infrastructure and technology in the world are meaningless without the clinicians, nurses, allied health professionals, support staff and leaders who make the system work. We should continue to aspire for the development of a health education and research hub, building a workforce pipeline that supports training, development and retention. That includes partnering with universities, expanding rural placements and investing in staff wellbeing. In May 2024, I addressed this House on the urgent need for an electronic medical record system for Albury-Wodonga Health, quoting the Chair, Jonathan Green. When compared to our metropolitan colleagues, our digital maturity is trending downwards. EMRs are the foundation of safe, modern care. As outlined by the Productivity Commission, EMRs reduce pathology testing by 6.3%, imaging by 12.5%, emergency department stays by 22%, and inpatient length of stay by 6%. That is not just cost saving, it's life saving. The introduction of an EMR is not a luxury, it is a necessity. It is the backbone of any modern health organisation, and I repeat my call for Albury-Wodonga Health to have an EMR. The Albury-Wodonga Health Statement of Priorities for 2024-25 calls for expanding virtual and home-based care, and rightly so. Initiatives like UNSW's teleclinical care, introduced to me by UNSW's Professor Nigel Lovell, show remote monitoring can reduce readmissions by 50%. By adopting these digital innovations, we better support chronic disease management, post-discharge care and avoid unnecessary hospital presentations, all the while improving patient experience. This is about delivering care where people live, work and recover. It's about dignity and access. In the 2025-26 Victorian budget, operational funding was secured to support 9 of the 16 new short-stay emergency care points. Let's be clear though, we are a long way from the service levels and activity-based funding that we require. We need a funding model that reflects the complexity of bi-state service delivery and population growth. One that gives line of sight to both state governments and Albury-Wodonga Health. One that supports innovation and funds value, not just throughput. And one that acknowledges that rural and regional health services face higher costs, unique workforce challenges and greater social disadvantage. Yesterday, I presented a petition on behalf of the Corowa, Rutherglen and Waganya communities, and I acknowledge their constructive engagement. We need a broader commitment to rural and regional sustainability in health, collaborative care models like those led by the Rural Doctors Network. Let's replicate, scale and embed these models in our community with the support of both state governments. We know the way forward. To get there, I urge our health ministers to engage and go forward with our community to an evolving integrated health system, fit for purpose, future-proofed and fundamentally patient-centred. Let's build on what we've started, not just today, but for generations.